Hello and welcome back to my channel. Today we're diving into a very important topic, opioid use disorder, often abbreviated as OUD. This is a condition that affects millions of people worldwide, and understanding it is the first step toward recovery. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Opioid use disorder is a chronic medical condition characterized by the compulsive use of opioids despite harmful consequences. Opioids are a class of drugs that include prescription pain relievers such as oxycodone and hydrocodone, as well as illegal drugs like heroin. These substances are incredibly powerful and work by binding to opioid receptors in the brain, blocking pain signals and releasing large amounts of dopamine, which creates a feeling of pleasure and euphoria. However, this euphoric feeling is temporary, and with continued use, the brain starts to depend on these substances just to feel normal. Over time, this can lead to physical dependence, where the body requires the drug to avoid withdrawal symptoms, and psychological dependence, where the individual feels an overwhelming urge to continue using the drug despite knowing the risks. To understand the gravity of opioid use disorder, it's important to recognize that this condition doesn't discriminate. It affects people of all ages, races, and socioeconomic backgrounds. The opioid crisis has taken a devastating toll, leading to dramatic increases in overdose deaths, particularly in the United States. Statistics show that tens of thousands of people die each year from opioid overdoses. This crisis has left families devastated and communities struggling to cope. But it's important to remember that opioid use disorder is treatable. There is hope, and recovery is possible with the right support and treatment. Recognizing opioid use disorder in yourself or a loved one is crucial. The signs can vary, but they often include an inability to control opioid use, spending excessive amounts of time obtaining and using opioids, and continuing to use them despite knowing the risks. Other signs include developing a tolerance, where more of the drug is needed to achieve the same effect, and experience withdrawal symptoms when not using the drug. Withdrawal symptoms can be severe and include muscle aches, sweating, anxiety, nausea, vomiting, intense cravings for the drug, and a general feeling of unwell. Because of these symptoms, many people find it extremely difficult to stop using opioids without professional help. Now, let's talk about treatment. One of the most effective ways to manage opioid use disorder is through the use of medications. These medications can help reduce cravings, manage withdrawal symptoms, and block the effects of opioids. There are three main types of medications commonly used to treat opioid use disorder: methadone, buprenorphine, and naltrexone. Methadone is one of the oldest and most well-known treatments for opioid use disorder. It's a long-acting opioid agonist, which means it activates the same opioid receptors in the brain that drugs like heroin and prescription painkillers do. However, methadone does this in a controlled way without causing the euphoric high that leads to misuse. Methadone helps reduce cravings and withdrawal symptoms, making it easier for individuals to stop using opioids. It's usually taken once a day under the supervision of a doctor, and the dose can be adjusted to meet the needs of the individual. Methadone has been shown to be highly effective, but it's important to note that it can only be dispensed through certified opioid treatment programs. Next, we have buprenorphine, another medication used to treat opioid use disorder and is an important part of my treatment strategy. Buprenorphine is a partial opioid agonist, meaning it activates the opioid receptors, but to a lesser degree than full agonists like methadone or heroin. This helps reduce cravings and withdrawal symptoms, but with a lower risk of misuse and overdose. One of the key benefits of buprenorphine is that it can be prescribed by your primary care doctor and taken at home, which makes it more accessible for many people. It's often combined with another medication called naloxone to create a formulation known as Suboxone. The addition of naloxone helps prevent misuse by causing withdrawal symptoms if the medication is injected rather than taken as prescribed. Buprenorphine has been shown to be very effective in helping people manage opioid use disorder, and it can be a good option for those who need more flexibility in their treatment plan. The third medication commonly used in the treatment of opioid use disorder is naltrexone. Unlike methadone and buprenorphine, naltrexone is an opioid antagonist, which means it blocks the opioid receptors rather than activating them. This makes it impossible for opioids to produce their euphoric effects, which can help discourage use. Naltrexone is available in two forms: a daily pill and an extended-release injection that's given once a month. The injectable form, known as Vivitrol, is often preferred because it helps ensure compliance with the treatment regimen. However, it's important to note that naltrexone should only be started after a person has been free of opioids for at least 7 to 10 days, as taking it too soon can trigger severe withdrawal symptoms. Naltrexone is particularly effective for individuals who are highly motivated to stay in recovery and want a non-opioid option for treatment. It's also used to prevent relapse in people who have already gone through detoxification. I just want to take a moment to ask that you hit that like button and subscribe to my channel, and leave a comment below if you have any topics you want covered in future videos. Anyway, while medications play a critical role in managing opioid use disorder, they are most effective when used as part of a comprehensive treatment plan. This often includes behavioral therapies, counseling, and support from healthcare providers, family, and peers. Behavioral therapies, such as cognitive behavioral therapy and contingency management, help individuals change their attitudes and behaviors relating to drug use. They also teach coping strategies for dealing with stress and triggers that might lead to relapse. Counseling and therapy can be done on an individual basis in group settings or even with family members to address the broader impact of the disorder. In addition to medical treatment, making certain lifestyle changes can help manage opioid use disorder and support recovery. Establishing a routine and setting goals can provide structure and purpose, helping you stay focused on your recovery journey. Regular exercise can improve your physical and mental health, reducing stress and promoting a sense of well-being. Eating a balanced diet that includes a variety of nutrients can support your overall health and help your body recover from the effects of opioid use. Ensuring you get enough sleep is also important, as sleep disturbances are common during recovery. Practicing good sleep hygiene, such as maintaining a regular sleep schedule and creating a relaxing bedtime routine, can improve your sleep quality. Avoiding triggers and high-risk situations is crucial for preventing relapse. Identify people, places, and activities that may tempt you to use opioids, and develop strategies to cope with these triggers. Support from others is also crucial. Recovery from opioid use disorder is a long-term process, and having a network of supportive people can make all the difference. This support can come from healthcare providers, peer support groups like Narcotics Anonymous, or simply from family and friends who understand the challenges of recovery. One of the biggest barriers to treatment for opioid use disorder is the stigma that surrounds it. Many people feel ashamed or embarrassed to seek help, fearing judgment from others. It's important to remember that opioid use disorder is a medical condition, not a moral failing. Like any other chronic disease, it requires proper treatment and support. If you or someone you know is struggling with opioid use disorder, know that help is available. Reaching out for support is a sign of strength, not weakness. Doctors, counselors, and support groups are there to help you on your journey to recovery. Opioid use disorder is a serious but treatable condition. Medications like methadone, buprenorphine, and naltrexone can play a vital role in managing the disorder, reducing cravings, and helping individuals maintain their recovery. But remember, these medications are most effective when combined with a comprehensive treatment plan that includes behavioral therapies and strong support systems. Recovery from opioid use disorder is a journey, and it's one that no one has to take alone. Whether you're just starting to seek help or you're supporting someone else on their path to recovery, know that there is hope. With the right treatment and support, it is possible to regain control and lead a healthy, fulfilling life. Thank you for watching. As always, take care of yourself and make the most of your day.